Hello everyone once again, and we will continue in exploring how voxel-based analysis is reshaping pediatric radiation therapy and how this approach helps us go beyond traditional dose volumetrics to understand the impact of radiation in young patients. Understanding the limitation on historic radiation therapy knowledge. Radiation therapy research highlights critical gaps in historical data concerning the relationship between physical radiation exposure and biological effects. As cancer survival rates improve, a more profound understanding of these dose-response relations is essential for optimizing treatment plans and enhancing long-term survivorship, especially in pediatric patients whose developing bodies are particularly vulnerable to radiation damage. Like children are not small adults, their developing tissues are most sensitive to radiation, and side effects may emerge years later. This makes accurate dose outcome modeling crucial for survivorship and quality of life. Increased sensitivity to radiation. Children's developing bodies are more sensitive. Such vulnerabilities necessitate careful consideration in treatment planning to minimize potential damage and maximize uh, therapeutic, uh, thera- therapeutic benefit. A long-term survivorship with cancer survival rates improving, children often live decades beyond their initial diagnosis. This long-term survivorship makes it essential to monitor and understand the late effects of treatment, including the long-term dose-response relationships. Crucial knowledge for treatment optimization uh, uh, throughout understanding of dose response relationship is crucial for optimizing radiation treatment plans. This knowledge ensures that children receive effective treatment while minimizing the risk of adverse effects, which is paramount to enhancing quality of life for young survivors. Uh, Focus on adult survivors, incorporating advanced computational techniques into survivorship research has primarily concentrated on adult patients. This focus has led to significant gap in understanding the dose-response relationship specific to pediatric populations. As a result, many relevant issues in childhood cancer remain under-researched, and the response, the radiation exposure are poorly defined. Lack of pediatric data. This gap highlights the urgent need for research tailored explicitly to child-specific anatomical and biological response. Advanced computational methods in survivorship research. Uh, Enhanced pattern recognition, compressed data integration, and voxel-based spatial analysis. So also image-based data mining, for example, so image-based data mining let us analyze dose distribution on a voxel level without pre-selecting organs or regions. By aligning those maps across patients, we can statistically uncover which regions correlate with adverse outcomes. Automatic contouring tools streamline the process of delineating anatomical structures in medical images, significantly reducing the time and effort required for manual delineations. This advancement aids in the optimization of treatment plans, ensuring better outcomes for young patients while supporting ongoing survivorship research. image data basic mining insight, uh, enhanced toxicity assessment, agnostic approach to analysis, promising preliminary results. IBDM use voxel-based methods to analyze the spatial relationship between radiation dose and biological effects, enabling a more nuanced understanding of toxicity. Agnostic approach to analysis. The voxel-based approach of IBDM allows for an agnostic investigation into the relationship between dose and toxicity, meaning it does not require prior hypotheses about which anatomical structure are involved. Promising preliminary results. Preliminary findings indicate that IBDM produced results consistent with traditional analysis while simultaneously revealing more comprehensive insight into the dose-response relationship in pediatric patients. Application of base data mining. Understanding the critical steps in image data mining enhance the identification of anatomical structures and their related effects in radiation therapy. So the first step will be spatial normalization, involves mapping individual patients' anatomy to reference anatomy using deformable image registration, accommodating the variable size and shape in children. The next step, dose analysis, analyze spatial association between radiation dose and biological effects, utilizing statistical methods like permutation testing to enter significant findings. Uh, Preliminary results and future directions. Align with conventional analysis, need for further validation, and assessing computation cost. So application of these methods will we applied IBDM to examine brain tumor survivors instead of relying only on dose volume histograms. We use deformable registration and voxel-wise comparisons. These help identify subtle dose-related neurocognitive effects in unexpected brain areas. So dose response relations remain central radiation therapy research, especially for pediatric outcomes. Advanced computational methods, including deep learning and image-based data mining, are crucial for enhancing these studies. These innovations allow research to analyze large datasets more effectively, revealing insights that can improve treatment planning and patient outcomes. Advanced computational methods such as deep learning and data mining enhance our understanding of dose response relations, enabling more precise treatment planning and optimization. Reducing variability in treatment by utilizing automatic contouring and image-based data mining, radiation therapy practice can minimize inter-observer variability and identify critical anatomical structure that drive toxicity, improving pediatric survivorship outcomes. So, the conclusion of voxel-based analysis is enabling smarter, safer pediatric radiotherapy with support from AI tools and multi-center collaboration. We're moving toward a future where every child receives optimized, personalized cancer care. Of course, we have some limitation and next steps. So, like the one of the biggest challenge include limited pediatric datasets, anatomical variation, and generalizing AI models trained on adults. Future steps include expanding multi-institutional cohorts and refining model precision with federated learning techniques. But like combining IBDM with insights with AI, contouring paves the way for data-driven, personalized radiotherapy. This can help reduce cognitive impairment, endocrine dysfunction, and other long-term effects in childhood cancer survivors.